The City of Seminole, presented by Elisa Rail, Elisa Sizik, and Justin Taylor.
The city of Seminole was incorporated on November 15, 1970. It has been referenced in history as early as 1528 when the Spanish invaded this land looking for gold. Russell Stewart became the first mayor of Seminole. Seminole is approximately 5.6 square miles with a population of approximately 17,000. Seminole is located on the west coast of Florida in Pinellas County. It is only a short 1.5 miles to the Gulf of Mexico. In 1879, people would gather at the homestead of Albert and Del Mears, which is now called Seminole City Park, and wait for the mail to arrive from Clearwater by horse and buggy. Many of the early pioneers are buried at the cemetery on 102nd Avenue, which is Lone Pilgrim Primitive Baptist Church Cemetery. Seminole Mall was built in 1965 and was torn down last year. Seminole Mall was considered the downtown area of Seminole. The city of Seminole has grown tremendously since its incorporation in 1970, with a population of 2,700. In the 90s, Seminole opened a new library costing $1.5 million, and Seminole Fire Rescue became independent, tripling the budget from $3.5 million to $11 million. Today, Seminole has a city hall, chamber of commerce, post office, recreation center, and St. Petersburg College Seminole campus. The city of Seminole also hosts the annual Pow Wow Festival and Parade, which was originally organized in 1969 to raise money for Seminole High School Boosters Club. Seminole Mall is set to reopen as early as September 2016, with Bell's Department Store being the first to open in March of 2016. The Seminole Historical Museum officially opened on January 27, 2016. The city of Seminole's main population is Caucasian at 88%. The second dominant diversity in Seminole is Hispanic at 4.6%. This slide shows the comparison in housing between the city of Seminole and its neighboring community of Largo. Statistics show that more people in Seminole own their homes than rent. The cost of living in Seminole appears to be higher as well. Opening up a more affordable rental population in Seminole could bring more diversity to the community. The median age of residents in the city of Seminole is 54. Another major source of housing is assisted living facilities. There are 10 within Seminole, which adheres to the growing elder population. This increases the need for Seminole to incorporate acute care facilities and more primary care offices into the community to better serve the elder population. There are also 5 apartment complexes and 11 mobile home parks where residents reside. There are no housing subsidies in the city of Seminole, and the closest shelters for the homeless are in Clearwater at Pinellas Hope and Pinellas Safe Harbor. There are 4 private schools within the city of Seminole, which are grades kindergarten through 8th grade. There are 7 public schools within the city of Seminole, with one of them being a fundamental school. A fundamental school is a high school that the community demands, with parent involvement, heavy curriculum, and high expectations for behavior and cooperation. This gives parents of the community a choice of where they want their children to attend school. Higher income families can afford tuition fees of private schools. St. Petersburg College also has a campus in Seminole. There are many religious organizations of different affiliations throughout Seminole. The number of churches in the city of Seminole is less than that of the city of Largo, but that is because Seminole is serving a smaller community. Churches throughout Seminole offer great resources in the community. Blessed Sacrament Catholic Church began working with Pinellas Hope in 2010. The volunteers serve the community by providing clothing plus a weekly meal to the homeless population at Pinellas Hope. St. Anne of Grace Episcopal Church provides clothing and toiletries for the homeless residents of Pinellas Hope. They also collect food donations at the food pantry. Lake Seminole Presbyterian Church offers a private school for disabled children, grades kindergarten through 12. Many local church chapters host Alcoholic Anonymous meetings. This is a good way to educate, help, and strengthen the community.
The Census Bureau of 2010 estimates that Seminole is a place of residence of over 17,233 people. This translates to a population density of 7,207 people per square mile. Just miles from the beaches, excellent public schools, and many senior living facilities has made Seminole a desirable area to live for people of all ages. In the last 10 years, Seminole has a 58% increase in population. Some issues noted in the population is that the Census Bureau does not take into consideration the population increase between December and April. Tourism and snowbirds increased the population of Pinellas County by 20%. This is evident throughout the window survey, with an increase of traffic and many more people in the community.
When comparing the city of Seminole and the city of Largo, two of the top health concerns are cardiovascular disease and hepatitis C. In Florida, 23.4% of adults aged 65 and older have been diagnosed with cardiovascular disease. In 2014, there were 57,410 deaths due to cardiovascular diseases, accounting for 3 out of 10 deaths. Hepatitis C is the most prevalent chronic blood-borne viral infection in the U.S., with an estimated 1.3% of the population infected. Chronic hepatitis C is often asymptomatic. Approximately 75% of infected persons may be unaware that they're infected. Transmission is mainly through blood-to-blood contact, and the most common risk factor is sharing of needles. The City of Seminole needs more educational resources, screening, and preventative health programs aimed at reducing these diseases.
There are no acute care facilities in the city of Seminole. The closest facility would be Baycare Health Center ER Bardmore in the neighboring city of Largo. Many services are offered here, including emergency center, outpatient rehabilitation, surgery center, MRI, and CT scans. There are over 100 physicians and specialists at this center. This is a nonprofit organization serving the uninsured, underinsured, and insured. All people can be seen at this facility, including children, adults, elderly, and pregnant women. Prices vary on services rendered and insurance coverage. If individuals needed to be admitted, they would be transferred to Morton Plant Hospital in Clearwater, which offers specialized care. There are many options for transportation to get to these facilities, including public bus transportation, demand response transportation for the disabled, and Neighborly Care Network Senior Services Transportation, providing free transportation for those 60 and over. All of these services help promote compliance with appointments and treatment.
3 of the Healthy People 2020 objectives that relate to Seminole, Florida are TU3 and 4 HDS 7 QA3. TU3 and TU4 reduce the initiation of tobacco use among children, adolescents, young adults, and adults. The leading cause of death in Seminole is lung cancer at 22.8%. It was observed throughout the windshield survey that there are many young adolescents and adults smoking. Increased awareness in the community to risk of tobacco use would decrease the number of people who start smoking. Given the number of fast food restaurants and obese people noted in the windshield survey, HDS 7 was chosen. HDS 7 reduced the proportion of adults with high total blood cholesterol levels. Heart disease and stroke are the second and third leading cause of death in Seminole. Elevated cholesterol is easily diagnosed throughout routine blood work and has modifiable risk factors. Reducing the number of adults in the community with high cholesterol would ultimately affect the number of heart disease-related deaths in the community. QA3 increase the proportion of older adults with one or more chronic health conditions who report confidence in managing their condition. 45% of the population in Seminole is greater than 60 years old. Much of this population has one or more chronic conditions. Providing education and teaching this population to better control their conditions will decrease healthcare costs and provide better quality of care to elderly population in Seminole.
Environmental resources in the city of Seminole are adequate and exceed the environmental resources provided by neighboring cities. Water services in the city of Seminole are provided by Pinellas County Utilities. Pinellas County reports that the water provided to customers meets or exceeds all federal and state standards for safe drinking water. As of 2014, the Pinellas County Utilities Water Station reports no violations in their Consumer Confidence Water Quality Report. Sewage disposal is provided by Pinellas County Utilities as well through water reclamation facilities. The majority of the city uses the county's sewage system. The city of Seminole has an exclusive contract with Waste Management to collect solid waste, garbage, and recycling. The cost of waste management is $36 every other month for residents of the city of Seminole. Air quality in the city of Seminole is monitored by Pinellas County according to the Air Quality Index, or AQI, established by the U.S. Environmental Protection Agency. The AQI describes the air quality concentration levels of sulfur dioxide, ozone, carbon monoxide, nitrogen dioxide, and particulate matter. The overall air quality of all of Pinellas County, Florida, including Seminole, is rated as good according to the AQI. The Pinellas County Mosquito Control Program treats known breeding areas by ground and air in the city of Seminole as well as all of the county. These technicians also monitor the environment for the presence of mosquito-transmitted diseases and act accordingly to minimize the risk to the residents. Concern has been growing within nurse education regarding the effects of the external environment on human health. One environmental concern of importance to the city of Seminole is the threat of severe weather conditions and hurricanes. There is one hurricane shelter located in the city of Seminole for those in evacuation zones. This shelter is located at Bowder Elementary School. The closest special needs shelter is located at Northside Baptist Church in St. Petersburg. Each resident's evacuation zone is printed on their Pinellas County Utilities bill. Pinellas County also has an interactive hurricane evacuation inquiry hotline. The City of Seminole has adopted the Council Manager Plan of local government. The Council Manager Plan is a system of local government that combines the strong political leadership of elected officials in the form of a city council with the managerial experience of an appointed local government manager. The government works at local, regional, state, and federal levels to decide on the city policies. Commission meetings are held regularly, and the public is always welcome to attend. In 2015, the majority of the city's expenditures were for the fire department operations and EMS. Property taxes comprise the largest percentage of the city's revenue.
6 overall community needs. There are many community identifiable needs within the community of Seminole. Smoking cessation is our first priority for the community. Lung cancer is the leading cause of death in Seminole. Providing education on smoking would aid in decreasing lung disease in the community. Chronic disease management is also important. Providing programs that would assist with managing these conditions would ultimately decrease hospitalization and healthcare related costs. Accidental injury prevention relates to motor vehicle accidents, recreational accidents, and falls. 45% of the population is greater than 60 years old, increasing accidental falls. Skin cancer is a major concern to residents of Seminole. With all the parks and outdoor recreational activities, overexposure to sunlight puts residents at greater risk for skin cancer. Healthy nutritional education is needed within the city. There are many fast food restaurants in Seminole, and obesity is prevalent. The last was alcohol treatment. Within the city, there are many bars. Alcohol abuse is a large health concern for residents of Seminole.
The number one cause of death in Seminole is lung cancer, with an estimated 1 out of 4 cancer deaths resulting from lung cancer. On a global scale, this is the second most common cancer in both men and women. 14% of all new diagnosed cancers are lung cancers. In 2016, it is estimated that 158,080 deaths will be from this disease. Smoking is the principal cause. It is estimated to be responsible for 85% of all types of this cancer. The highest incidence was in North America and Europe, and the lowest in Africa, Latin America, and the Caribbean. There is convincing evidence that arsenic in drinking water and beta carotene supplements increases the risk of lung cancer. Analysis of global research shows that about a third of the most common cancers are preventable through a nutritious diet, maintaining a healthy weight, and regular physical activity.